Hi, I'm Norman B. I got a letter from AARP saying that I should join up. Now, I may have thought that I would join up at some time to AARP. I mean, in the past, like before the past few months, I had the impression that there was something good about them. But the way that they've behaved in the past couple of months is despicable. And I am certainly boycotting the AARP, and I wouldn't have anything to do with an organization that's that unethical. The AARP is there to watch out for the rights of retired persons. Now, obviously, the best thing for retired persons would be to have a single-payer health care plan for everyone in the country. If we're all in the same plan, that's the cheapest it can possibly be. Everyone should be covered the same way, and that's the way it's been proven to be viable in other countries. Now, if we have it, the other system, the corporate welfare system that gives huge amounts of money to insurance companies, that's just trying to make it not work. That's corruption. There's no reason why insurance companies should get part of what legitimately belongs to the American people. Now, what the AARP did, selling out people who they're supposed to be protecting is one thing. But then to take the next step and try to rig a presidential election or intimidate the candidates, and then it worked. Here's what really troubled me, that in the run-up to the Iowa presidential debate, the Democratic debate, there were three candidates that supported single-payer health care: Gravel, Kucinich, and Obama. Well, the AARP sponsored one of the debates. They didn't allow those three in the debate. Well, they came up with some other reason why they wouldn't allow them in the debates. But they didn't allow them in the debates. And then, instead of debating health care and whether there should be single-payer, the moderator just asked, looks like nobody here would be for single-payer health care. Anybody here for single-payer? If you are, raise your hand. That was how they debated it. This is rigging the election. See, Obama, at that point, favored single-payer health care. Then, because of pressure, because of him being kept out of the debate, perhaps, he has changed his position. Just recently, last week, Hillary Clinton attacked Obama in another debate, saying, "You used to be for single-payer health care," as if that was a terrible thing. And he denied it as if it's a terrible thing. No, I was never for single-payer health care. Well, I've been a fan of Hillary Clinton for a long time. Well, actually, since the day she came out with her health care plan, way back in the 90s. It was inspiring, but Hillary Clinton did the same thing that Barack Obama did. She was, she was roundly attacked in every newspaper in the country. They just torpedoed her constantly. What a terrible idea it is to give everybody health care. So after about a month of that, she backed off and said, "Oh well, but let's." Basically, came out with the type of plan she has now, that it would be corporate welfare, and there'd be lots of money for insurance companies, lots of money for drug companies. See, that's another big part of it, and well, of course, as you must know, here in the United States, we pay more for health care than anybody in any other country, but we get less for it. Fewer people are covered, but we pay more. And a big part of it is the insurance companies taking so much money now with required health care. It's corporate welfare right to the insurance companies, instead of having one public company that we all hold, that we're all part of, and we all share in the benefits or costs proportionally according to our income. That's the way that it can work. That's the way that it does work. But letting the drug companies in is also a failed strategy, because drugs, pharmaceuticals, they're worth nothing. They claim that they have to charge so much for research and development, but actually the truth has come out. They really spend a lot more on advertising, chasing doctors into the emergency room and distracting them while they're supposed to be at work. They spend a lot more money on advertising directly to doctors than they do on research and development. Chemicals are worth pennies. They're almost worth nothing. Yet it's our biggest industry. All of that is being stolen. I mean, they're not worth $100 for a month of pills. No, there's no pill that's worth that. No pill that costs anywhere near that. They cost pennies per dose. All of them. It's what they do. The drug companies have got your health at hostage, and they're holding it ransom, and they're going to make you pay as much as they possibly can. It's severely unethical, and none of the presidential candidates should be supporting it, and they should all have the courage to come out against it. But of course, there's money from those drug companies, there's money from those insurance companies that will help pay for them to be elected. But if somebody gets elected because of that type of concern, how much can we trust them?